All right, guys. So you know how I tell you, I absolutely hate the politicization of the vaccines and this virus, right? It's honestly one of my biggest pet peeves. It really is, right? And the reason why is because it's a lot of mud slinging, and I think that ultimately it works against the best interest of public health and freedom, which in my opinion, I believe can be balanced. However, we can never find a balance there if we continue to fight each other about things like, masks and vaccines and all types of stuff that really, in my opinion, are personal choices. However, there are just some people that just don't see it that way, right? And, there's a lot of people in this country that are going to use their power to enforce mandate, right, in the name of public health, that I think really is working against what they say they want. And I think a good example of this is this doctor out in Florida, Dr. Linda Marraccini, who has come out and said that she will refuse to treat patients who have not been vaccinated. Take a look.
South Florida doctor is giving her patients an ultimatum.
Yeah, either they get the COVID vaccine or they'll have to look for another doctor.
NBC6 reporter Amanda Placencia spoke to the family physician about her decision. No vaccine, no treatment. One local doctor is taking matters into her own hands to encourage her patients to get the COVID vaccine.
I understand people are free to choose, but to me, it's a problem when it affects other people.
Dr. Linda Marraccini accepts most types of insurance, but she says she won't treat you in her office if you're not vaccinated from COVID-19. With the Delta variant causing the latest COVID surge, she says she had to make a tough decision for her practice.
When it comes to the safety of others, and when it comes to it's a global health problem, community health problem, at this point, I really say that this is where it draws a line in the sand for me.
The family practice physician based in South Miami sent this letter to her patients saying they will no longer continue seeing patients who are not vaccinated by September 15th, as they don't want to subject other patients and staff to unnecessary risk. She says their decision was based on science, not politics.
And there's been also millions of deaths globally. So, I mean, that's not something to ignore. People are getting to where everybody knows somebody that died from COVID. This is a problem that really everybody needs to help out with. And it's affecting our collective communal health.
Dr. Marraccini says her letter does not violate the Hippocratic Oath regarding the obligations of doctors to their patients because she's still giving the option for telemedicine or referral to other doctors. But can she do this without violating state law? Governor DeSantis signed a bill earlier this year banning vaccine passports. In September 16th, Florida could start issuing up to $5,000 fines to businesses, schools, and government agencies that ask for proof that you're vaccinated. We spoke to attorney Juan Carlos Planas about the legalities in this specific case.
I don't believe you can treat a medical clinic the same way you can any business. But I also think that she lays something very crystal clear that will probably impede the state's ability to fine any business. She lays out in a medical way how exactly she wants to protect her staff. And she specifically states that no medical professional has found many people who cannot be vaccinated for medical reasons.
Dr. Marraccini says only about 15% of her patients were hesitant about the COVID-19 vaccine. She gave many of her patients about a month to figure out a plan moving forward. Amanda Placencia, NBC6 News.
All right, guys. So first off, like any of the videos I do talking about the virus, the pandemic, the vaccine, mask, whatever, I'm not making any claims about the virus, the pandemic, vaccines, masks. I'm not making any claims whatsoever about anything. This video topic right here is purely about public policy. If you have any questions about the vaccine, the mask, the virus, the pandemic, consult your doctor. Consult your doctor, right? And in this case right here, if this person, Miss Linda Marraccini, was your doctor, you might not be able to consult her because she is refusing to treat people who are unvaccinated. Now, here's the reason why I have issues with this, right? The reason why I have issues with it is because as a medical professional, one, you're not denying people whom put themselves in danger or are a threat to public health under any other situation, right? You're not denying smokers. You're not denying people who are obese, okay? Both of those things put a strain on the system. They negatively affect the health of other people around them. And like I said, they're preventable, right? There are things that people can avoid via lifestyle choices. But you never hear these doctors come out here and say that, well, we're not going to treat you because you made bad lifestyle choices. I mean, let's use an even more extreme example. If you have somebody that breaks into somebody's home and tries to murder the people in the home, and the intruder ends up getting shot by the owner of the house in the process of trying to go into that home and harm somebody, that intruder is still going to get medical treatment, even though they tried to take somebody else's life. The doctors are not going to say, oh, we're going to refuse to treat this person because they try to break into somebody's home and murder somebody. That doesn't happen, right? I mean, and that's an example right there where somebody's literally trying to take somebody else's life. If you go out here and you drink and drive and you end up in a car accident and you need emergency medical treatment, they're not going to refuse to treat you because you were drinking and driving. They're going to treat you. They're going to treat you. So even in the most extreme circumstances where people are putting other people's lives in danger, right? Either accidentally or purposely, medical professionals still treat those people. They don't refuse to do it just because, well, I don't agree with, this person drinking or driving or breaking into somebody's house. They don't do that. So again, in those scenarios, if you don't do that, then again, to me, in my opinion, why would you do it for this? Now, again, I understand all the arguments, right? I get it. I understand wanting to keep your staff safe and all that. But, we do have social distancing. We do have masks, particularly the N95 mask that I'm pretty sure, she can get access to. You have shields in front of the counters. Like, there's all types of PPE and other measures that you can put in place to help try to reduce risk. But in my opinion, as medical professionals, you sign up to treat patients, even in the most dire of circumstances, like a pandemic. You still have to treat those people, right? This is what you signed up for as a doctor. Yeah, I get it. You don't agree with, people's stances on, not being vaccinated or whatever. I 100%, I get it. I get it. But in my opinion, you're really doing yourself a disservice as a doctor. And here's the reason why. Because a lot of people, when they have a primary care doctor or whatever, that's the person they trust with their health. That's the person that they trust with their life. Okay? So you are the individual that can convince somebody who's not vaccinated to get vaccinated. You're the most likely person to convince that person. Now, it may take some pushing and prodding for you to actually get it done, but you are somebody who can convince that person. Somebody comes in and says, hey, I'm not sure about the vaccine. You can say, well, what questions do you have? Let me try to answer all your questions as a medical professional and let you know, hey, this is why this is wrong. This is why your understanding of this might be incorrect, blah, blah, blah. This is what the data says. You let the idea speak for itself. You let the data speak for itself. That way, again, you are somebody that's there to help that person make the best decision for them. But when you tell that person, hey, you know what, I refuse to see you because you don't want to do what I want you to do in regards to, getting vaccinated, then you've essentially given up on that patient. You've given up on that patient. You've given up trying to help that patient, right? You have people that are coming in to these doctor's offices that don't necessarily have COVID, right? They're coming in for other medical conditions that you're now saying, well, I'm not going to treat you for, your heart disease or your cancer, okay, or your diabetes or whatever other conditions that you may have because, well, you're not vaccinated. So now those people have to go find another doctor. Some of those people, who knows, maybe they won't go find another doctor. Maybe some of these people that are coming into this office have a disease that they don't even know about, a life-threatening disease they don't know about, like cancer. But because you decided, hey, I'm not going to see them anymore, maybe they choose not to get the medical treatment they need. Maybe they choose to wait longer than they otherwise would be waiting, which could cost them their lives. And you're doing this all because you don't want to engage in a battle of ideas anymore. You don't want to do your job as a doctor and say, hey, you know what? I'll see you. We're going to social distance. We're going to wear masks. We're going to try to keep each other as safe as possible from this virus. But at the same time, I'm going to be here if you have questions, if you want to get vaccinated. I'm assuming that because it's a medical office, you guys are vaccinating people, right? And you have to vaccinate people in person. So are you going to refuse to vaccinate people because they're unvaccinated, right? Those are the questions that I have about this. And then she wants to say, well, it's not political. In my opinion, it is political. It has become political because you're not doing your job anymore because you have certain beliefs about mandates that people should have. And again, that is political. And then she wants to talk about, well, I believe in personal choice and personal freedom. Well, apparently you don't, right? Because if you believed in that, then you wouldn't be refusing to treat patients who are not vaccinated. Now, obviously, yeah, they have a choice to go somewhere else. But in my opinion, if this person, this doctor was running this country, it sounds to me like she would probably have a federal mandate because look at her own actions. Look at her own actions. So like I said, man, in my opinion, my biggest issue with this is that I think that these doctors who claim to, be so concerned about public health and trying to get people vaccinated are really working against their own best interest, right? In the same way I talk about the left, when they want to talk about, certain things when it comes to public health and stuff like that, but yet they turn a blind eye to events that are obviously not compliant with what they say we need to be doing for public health. It's kind of the same thing with these doctors. It's like, you are the most trusted medical professional in a lot of people's lives. If anybody's going to convince somebody to get vaccinated, it is you. So it is imperative that you probably should want to see unvaccinated patients. Obviously, take the necessary precautions to protect yourself and to protect your office. But at the same time, refusing to see them, in my opinion, is not really working in your best interest because you are that trusted source. If anybody's going to convince somebody to do it, it's got to be you. Right? But when you refuse to engage in the conversation to try to convince people, now all of a sudden you're working against what you claim that you want. So let me know what you guys think. Make sure you like, comment, and subscribe. Most importantly, share a Black conservative perspective. Peace.